Hey everyone, General Manager Tony Mazzucco coming to you with our weekly Facebook Live. We're going to get started in just a moment as folks get logged on. As soon as my computer gets set here as well. And let me get, there we go. All right, folks are starting to go ahead and get logged on. We started on time today, so welcome everyone. We'll get going in just 1 minute. Hi, Catherine. Thank you for joining us this week and every week. All right, we're at about that 45-second mark, which is usually where I begin now that we've gotten pretty pat at doing these things. Hey, Alyssa, thank you for joining us. I'll start with a couple things. We're going to go over our COVID numbers. We're going to go over the vaccine rollout, which is turning into quite the challenge, and then we have a couple of other updates. Hey, Michelle, thanks for joining us. Thanks to Segal for covering last week. I unfortunately had to be in two places at once, so she did a great job, and I certainly appreciate her for that. I want to start for just a minute talking about Bernie Cooper. I think, as most people know, we got the certainly sad and sudden news that Bernie Cooper, who's the assistant town manager for Norwood, had passed away relatively unexpectedly this past Sunday. He had had a brief illness, but certainly nobody expected him to pass away. Bernie had served the town for close to 50 years. He started actually as a CETA worker, which was a federal grant program back in the 70s. He then became an administrative assistant to the general manager, and then assistant general manager. He's only the second assistant general manager. The first was a gentleman named Jack McAuliffe, who was also our purchasing director for a while. Bernie again becoming the assistant general manager in I believe 1976 or 77. He actually worked with John Mogan, who was the town manager from 1972 to 1978. Then John Carroll, who's the town manager from 1978-79 up until 3 years ago, 2018, when I became general manager. So Bernie worked for three different general managers over quite a career. Bernie was an employee. He did his staff job, and he had his staff responsibilities. But what he did out in the community in terms of volunteering, I mean, there was always sort of this blurring of, was it his responsibility as a town employee or just Bernie doing it? And more often than not, it was Bernie doing it. The concerts on the Common, the 4th of July parade, the Carillon concerts, the Carillon itself is still here, largely because of Bernie. And I'll actually tell a quick sweet story about that. Hazardous Waste Day, and people always came to Bernie for help, and he always found a way to help people. Those of you who were able to stand out yesterday, either in front of Town Hall and see the procession as it sort of went by, it was very fitting that Lee Leach was able to ring one bell in the Carillon for Bernie as the procession was going by. The last time we did that, somebody actually had to manually go in and ring a bell because the Carillon is actually being disassembled right now so that it can be restored and worked on. The last time we did that was about 37 years ago. It was right around when Bernie got married, and as he was driving through town, the person doing the restoration then rang that one last bell for Bernie and Connie as he drove through town. So we found it fitting that we do the same thing 37 years later or so for Bernie as his funeral procession headed towards Highland Cemetery. So I know certainly I have lost a friend. I think the community has lost a great public servant and just a great human being. So we're going to be reeling from this for some time. It's hard to quantify the impact he had on a lot of people and so many people's lives. But this is just the beginning of remembering and celebrating Bernie's life. There's a lot of things that we're going to do in the coming months and years to remember and to celebrate Bernie. So stay tuned, and some of you may be a part of that. I think there's a lot of things that are going to come to make sure that Bernie is remembered and celebrated for many, many years and decades and generations to come. So thank you to Bernie for always being there for us. I'm going to switch gears into our COVID numbers. I know it's hard to go from a sad topic into a somewhat sad topic. But in terms of our COVID numbers, and not to make this all about just remembering Bernie, but like everyone, the first 2 or 3 months of the pandemic, Bernie worked 7 days a week. Never had a problem putting himself at risk, and never had a problem taking any chances to make sure that people in Norwood got what they needed. So he's sort of one of those unsung heroes in our fight against COVID from the absolute very beginning, from when we first sort of realized we had a problem and started going from there. In terms of our COVID numbers, Statewide, they're trending downward. In Norwood, they're actually still creeping up, slowly, but they are creeping up. Our percent positive rate is around 6.85%. That's a little bit down, which is a good thing. So remember, that's the percent of people who are tested who have been positive. It's been as high as 7.5%, but if you can remember, there was a point in time where we were worried that anything above 2 was bad, so everyone seems to be hovering around that 6 or 7%, or most communities. If everyone remembers the red, green, gold, or whatever system, that I think nobody's really paying attention to, because most communities are in the red now. So that system didn't really survive too long. Our numbers are increasing week over week, which is concerning. It's a slow increase, which is a good thing. The rate of increase we're seeing now is, probably a little bit less than it was in October. We saw our big jumps in December, and they've kind of jumped up and stayed there. In terms of raw cases, we're probably up about 15 cases over our last reporting period. One positive note is 5,200 tests have been done in the last 2 weeks. So our testing number over the last 5 to 6 months has continued to climb, which is a good thing. There was a point in time where if you told me we were doing 5,200 tests in Norwood in 2 weeks, I would have said that's absolutely impossible, especially without the hospital. But that's a good thing. It's positive, and we'll continue with the testing. We're grateful that Norwood Hospital has their testing trailer here, and there's a number of other facilities testing, so it's good that we have that availability. The governor has relaxed some of the Norwood provisions, not the Norwood provisions, some of the provisions related to restaurants and other retail establishments. So bars can now be open past 9:30. My own sort of take on that is they probably never should have done that to begin with, because I don't think it was targeted enough to make the impact they wanted. I think you had an enforcement issue in certain places, and I think the Commonwealth maybe should have focused on enforcement in those places and not penalized a lot of businesses that were not having enforcement issues. But luckily they have relaxed that, so bars can be open past 9:30 at night. Social distancing still required, masks still required. Those things are still important because COVID numbers are continuing to go up. I got word today that a longtime family friend recently passed away from COVID, so it may be out of our minds as we're focusing on what's going on in the world and the vaccine rollout, but COVID is very much still here. It is very much as deadly as it ever was, if not more so, and we need to continue to remember that and continue to wear a mask, practice good habits, be cautious when you're around other people, still trying to keep your circle small. And it happens, we're all going to gather here or there, but always trying to keep your circle small. It's becoming more evident, at least with me, I'm sure most folks are seeing this, that it used to be you didn't really know anyone who had COVID, or it was on the news, and then all of a sudden it's someone somewhere has had COVID. And that's because it is still out there, and it is still spreading pretty rapidly and continuing to increase. As we always say, we do need to look at a couple of weeks of data. Our increase in the last 4 to 5 weeks hasn't been substantial, at least once we hit that post-holiday boom. So the hope is you kind of hit that boom, and as it levels off and only goes up a little bit, hopefully it will start to come down. Janet, thank you for joining us every week. We'll continue. We're almost at a year of these updates, and we'll continue to bring them every week. Our January 21 report, which is last week, we're waiting on state numbers, has been posted. Every week the health department posts their updated COVID numbers, and it's pretty interesting information, especially if you like that kind of data, to see where we're going. We always seem to trend a little bit differently from the state. We joke that, well, Norwood is special, so we'll never kind of go exactly along with the trend. So the state's seeing a little decrease, we're really not, but we're either ahead or behind that curve depending on what's going on. You saw only sort of urban and dense communities having being in the red, and then it happened to mid-sized communities and rural communities, and it's just gone up and up and up. I'll jump into some vaccine information, but I'll jump into answering Katie's question. When the town gets their weekly allotment, who does that go to? We sell them on eBay. No, I'm kidding. We follow with our allotment what the state phases are. So the way it works is there's a list of phases, and you can go up a phase is the preference. So I guess what I mean by that is, let's say you were a nurse at a hospital and for some reason you haven't gotten vaccinated yet. We can vaccinate nurses, etc. We sort of go down only if we have additional vaccines, but I want to talk about that because you're seeing that in a lot of places, and it is going to happen. So the vaccine comes in doses of 10, and what most organizations do is, you always put a shot in the arm. So if for some reason we scheduled 19 people, we know we've got to go find a 20th person. Sometimes people can I don't think we've had any real cancellations of any of our appointments. We've had occasionally somebody's gotten a vaccine somewhere else from different places, whether they have I know the VA has done a lot, that they're sort of have their own allotment and their own federal rules. But so sometimes people have contacted us that, one of our first responders that says, hey, I got it at the VA. So while I don't want to say we randomly grab people off the street, we make sure a vaccine goes in every arm and that we don't waste any. We're limited to about 100 a week at the local public health level. We've talked with other vendors in the area occasionally where our numbers have been over that. We've called either Stewart's operation in Westwood or somewhere else and said, hey, we've got 118 and we can only do 100. What can do you have any extra capacity? So that's helped a little bit, but most people are in the same situation as we are, that's sort of a day-by-day situation that comes up. We're also not sure who necessarily has the vaccine, and it hasn't been at least made clear to local public health every operation out there that can vaccinate, and we don't necessarily get word of that. We get word of what our allocation is, so it's here, you're going to get 100 a week, which we were initially furious about, and I'll explain the many reasons why we're furious that that's all local public health is getting, but that's apparently what's been allocated to communities much larger than us. So we originally hit the roof that it was 100 a week, but we also found out I think Somerville and Cambridge are getting 100 a week, and Somerville being about double our size and Cambridge about triple our size. If we're frustrated with our ability to utilize that 100 a week, I can only imagine communities 2 and 3 times our size getting that amount and where that would go. The governor's recently changed the priority order, which has candidly screwed up a lot of planning on our part and completely changed what we had planned for at the local level. Dana will definitely give an update on the hospital a little bit later. It's still no major update, but we'll give a small update. And Bob, we have sort of an internal standby list of who do we grab that we know out of our staff who would be in sort of that next group, and other people that we can have respond. The problem is at 100 a week, extra doses, if we will, and they're not extra doses, it's just when we schedule 9 out of 10, it might be like 2 people, because that was something we originally looked at and said, hey, let's get a big list going, and then it ends up being just, we're not only not seeing that extra shot here or there, it's just a list would get exhausted. We'd have 5,000 people on a list and we could maybe get 10. We originally thought, hey, if we're doing 500 a week or 1,000 a week, we'd probably be able to have 20, 30 people and get community volunteers and people from other phases and get them in, and it's just our allocation has been incredibly small. Has contact tracing shown any particular behaviors that we should be more mindful of as we try to spread in our day-to-day? Not directly, and I'll give a good analogy of where we get frustrated with the contact tracing process. It's very similar to recycling. So there's certain rules for recycling, and we have very conscientious recyclers, and we love our conscientious recyclers. And every time we hammer out information on there on recycling about, hey, don't throw this in there, and this is what you need to do. What happens is the people who rinse their spaghetti jars out, because it's good to rinse your spaghetti jar out before you put it in the recycling bin, they run to the sink and then they scrub it really hard with their sponge. So it's like, okay, well, you probably don't need to do that. We appreciate it. But it's those people who are going out and doing it, and then you get the people who are throwing, an old cat bed in their recycling, and then people who are throwing an old deflated basketball into their recycling bin. So we keep pushing that information out, and the conscientious rule followers go even harder at following the rules, which is appreciated but marginal, and then the people who just aren't following the rules just aren't following the rules. We had a case at this point, I don't know if it was over the summer or in the fall, it all sort of blurs together, where somebody got quarantined because they went and spent time at somebody's house who was under quarantine, and that person ended up testing positive. And then this person tested positive, and it's like, poor people like you, Amanda, are saying, geez, there's something else I can do when I go out, and then you got people who do stuff like that. And it's just like, oh my God. I said a few weeks ago that stupidity is the cause of some of the spread. Not all. COVID spreads very easily, but stupidity is certainly an issue. Double masking, like anything, it's better than single masking. In terms of advocating it, if you're comfortable doing it, by all means, it's about your safety level. It's always helpful. I haven't double masked yet, but I'm not really in that many situations where I'm around too many people. I have I have 2 different masks that I use for the most part. I finally did invest in a good quality mask. It was like $28 because I kept going through cheaper cloth ones and breaking paper ones, and I finally said, if for no other reason from a sustainability standpoint, rather than go through 80,000 masks, I got one decent one. But yeah, it's always helpful. You got to sort of look at your risk level. Again, if you go into the drive-through at Honeydew, your risk level is probably pretty limited there. If you're going to be in a crowd, not that we should be in big crowds, 2 masks is certainly helpful. There's times where you just can't avoid it. But it's about your comfort level and making sure you're managing your own risk. So Amanda, just back to your point about the contact tracing, there's a good portion that's just stupid behavior. There's a good portion that's just completely unavoidable. The basics of washing your hands, keeping your distance, avoid big groups when you can, avoid parties when you can. It's one thing that 3 or 4 people sit in a kitchen and celebrate somebody's birthday. That's okay, and be careful about doing that. When somebody says, hey, come over, we're having 25 or 30 people over, it's been tough from a professional standpoint that I haven't gone to any police and fire promotion ceremonies anymore, because it's like, well, I don't really want to do that. And sometimes I go and meet with staff and there's 8 people at that end of the room and I'm at this end of the room. It's tough. So the more you can just be conscious about what you're doing, and we always advise people, if you've expanded your circle, just be conscious of it and try not to do a whole lot of it at once. So friends happen to come into town for some reason, or you have a funeral or a wedding or a wake, and those are some of the most difficult things, and you're exposed to more people than normal, try to be careful for the next couple of days. If you have to give an in-person presentation at work, don't do it after going out with 10 people the night before, because now all of a sudden it's 10, and then it's 15, and then it's 20, and then you decide to have the neighbors over, and then you decide to go volunteer in a kid's classroom. There's probably not a lot of that going on, but that's certainly a potential issue. One of the things that the governor did in particular that certainly we're frustrated with is housing authorities, or residents who live at a housing authority, so that's congregate housing, it's dense housing, largely low income and elderly, have been kicked down the road a little bit in the phases. They sort of haven't been, but it's confusing. And then teachers have now been phase 2.3. And we were a little furious with that because we had been planning for quite a while to get all teachers done in a short period of time. We had a plan ready, we had marshaled resources, we had sort of drilled on, and it was, we're going to get this done. And we haven't yet been told whether we're going to get the allocation to do that, or whether teachers are going to be expected to just go somewhere else. If they're just going to tell teachers, well, your phase is open, kind of go wherever, and I'm only getting 100 shots a week, I have 500 or 600 school employees. You know what I mean? In addition to having to do everyone else. Now, the large sites like Gillette are have a lot of vaccine available, but even then, we're talking about it taking weeks and months to get that first shot for teachers, and then 3 weeks later, that second one, and if that phases out, the timeline of that does not look positive. We were told we'd be doing schools, then they said, well, we don't know. We were told we'd be doing housing authorities. We did the same thing. We talked with the housing authority. We said, great, we got, they have 30 or 40 staff, and then they have, 580 residents, or whatever the number happens to be. So here's how we're going to do it. And it's changing every day after we make plans, to the point where we almost don't want to plan for anything other than the fact that it's irresponsible not to plan, because it just keeps changing at such a rapid pace that it's, well, here's how we're going to do it. And it's, no, you're not getting this, or you're not getting that. So then we change, and then we change, and we adjust, and we're still just getting our trickle of vaccine. We were told that the allocation for housing authorities won't come out of our local allocation, which is actually very practical, because with, let's say 650 housing authority residents, at 100 a week, and assuming we have other people signing up, you're right, it can't come out of our allocation. Otherwise, it's going to be March or April before we finish housing authorities, which means we wouldn't even start schools until, April or May. If they do the same thing with schools, as long as we get the allocation, we can still get all of our teachers done, which has always been our priority, in probably a two-day period. Doris, so the information as of a couple of hours ago, because it's changing sometimes in the middle of the day, if you're 56 with 2 pre-existing conditions, you are, I believe, even past teachers and essential workers. Because it's folks over 75 are first, and then it's 65 with 2 comorbidities. And just to give everyone an idea, and we're going to talk about seniors in what I think has been a real sort of screw job for our seniors that appears to be helping them, but it really isn't. Norwood has something like over 5,000 people over the age of 75. So that's a very, very big group. And then when you go from 65 to 75, that's a very big group with 2 comorbidities. As everyone knows, the older you get, you generally have more comorbidities. Folks living in senior housing or low-income housing, sometimes fit those categories. Sometimes they don't. Actually, most people in senior housing will fit those. Um, so it's just probably the reverse of what I think they should have done, but I'm also not, the state that gets to make these decisions. The state rolled out a plan and started to change it based on input and pressure, which I understand. The concern now is there's a fairly complicated system for seniors. So first of all, the state's doing it only online, which I've always advocated for people. You have to be able to get online, even if you're a senior and you've never done it. The internet has been around 30 years at this point. You have to try to do it. You have to do it to be a part of society, right or wrong. That's how it is. Well, sometimes seniors, and we're talking about really our super seniors, so the much older seniors, not all of them, they have challenges getting online and registering, and I don't blame them. The site's not terribly complicated, but it's not the easiest thing in the world. Quick funny fact, a lot of our seniors have told us they don't have a computer, but they have an iPhone, and they have trouble logging on from their iPhone with it. So the software was not really well adapted for multi-device use, which is frustrating because among our senior population, more of them are apt to have a smartphone or an iPad than a full computer nowadays, because like a lot of people, you don't always have a desktop. We have some concerns about the Gillette site. The reason being we have concerns about the Gillette site is a lot of people are having to wait, and they're having to wait for quite a while, possibly stand up. So we're advising folks, if you're able to, bring a small chair. I don't know about escorting your senior there, but certainly at some point the decision wasn't really made with actual seniors in mind, because at the local level we would say, gee, there's some sort of an issue here with technology, we want to do that, and most seniors don't want to stand in line for 2 hours and have to drive out of their community to somewhere that can be a little challenging or confusing to drive through. I certainly never love having to drive to Gillette to get it, and forget about it if it's the Fenway site. That's not the way I would have gone about it, and here at the local level we've talked about it. We would have much preferred that we got a bigger dose and we could have taken care of our seniors. I understand the need to take a step back and look at it as a commonwealth and how you can get mass amounts of people done, but if we got 30,000 doses tomorrow, we could do the entire community in 5 days. Government has planned for this for decades. The rollout, for some reason, has not gone along with 20 years of emergency planning and mass vaccination planning. Neither here nor there. I can't change that. We're concerned for seniors. The senior center will help seniors register if they're not able to, but that's likely to take longer than doing it otherwise. Yeah, Katie, that's kind of my frustration is, it's almost like they made a decision not knowing senior citizens, because the first thing I said is you're going to make them register on the computer and you're going to make them stand for 2.5 hours. We're concerned about that. Unfortunately, being limited to 100 doses a week, and as we sort of go into different phases, we capture people from those previous phases, and that could have been, any number of people. We don't really know. There's court officers that may live in town for whatever reason, and some people not able to get their shot. So I agree with you. We're not thrilled with it. So you can, if you're a senior in town, you can call the senior center. They'll take your information and they'll work on getting you registered for our clinic here in Norwood. Just understand it's likely to be a longer timeline than if you were able to get into Gillette. Fully understanding that some folks can't get into Gillette, and that's simply not going to work for some seniors. It's just not practical for a lot of seniors. But at 100 doses a week, we're going to be going slowly. We've administered to date 180 doses. I think next week we start our second round for first responders, or it might be the week after. I'd have to check the calendar. Yeah, drive-through would have been a much better way to do it. Really any kind of a system other than what they currently do, and maybe they'll change once they start getting mass numbers, but we just I don't know, not our decision, and I hate to pass the buck, but I think the state, the governor may not have done that very well. Those of you who questioning, the town set up something so volunteers could help seniors sign up. We have we have staff in-house. That's a great idea. We can get seniors signed up. The challenge that we have is if they're wanting to get signed up in Norwood, we're limited to that no more than 100 a week. So if I've got 6,000 seniors that want to do it, it's like, oh man, that's a struggle. And we can help them get registered at some of the other sites. It's just it's a longer, more complicated process. And what we run into, for instance, is a lot of seniors don't have an email address. So that's how they get their information. So we can go online and help them register at Gillette, but then we're sort of communicating with them and hoping that they have an email address, hoping they get information, or it comes to us. The senior bus could do trips to Gillette. The only problem with that, Katie, would be that we'd have to get 5 or 6 seniors, or however many can fit on the bus, distanced to get all of their appointments right in a row, and that's the challenge with it. Great question from Laurie. Can't wait in line for hours at Gillette. Do you foresee the state will update the town allocation in a few weeks? I certainly hope so. I don't know how we're going to get 6,000 seniors in Norwood vaccinated with a lot of them going to Gillette. Some of them are perfectly healthy and they don't have a problem doing it. Right off the bat, we sort of threw our hands up and said, what the hell? If we get more doses, we'll be able to do more and have it start, take care of more of our seniors here. We're doing it right at Town Hall. We also had concerns that we wanted our seniors to be able to talk to somebody they know, get their shot from somebody they know, just like they do with their flu shot, and to go somewhere they know and that they can get to fairly easily and conveniently. And again, if we had the shots, we'd be able to do every senior in town. There's so many models out there. It's just they're trying to drive everyone to the mass sites, which sometimes logistically makes sense, but us at the local level, it's just going to be a problem. If you have a senior in town that you love and you're trying to get them an appointment, just be patient. We think this is going to take quite a while. And the Gillette is there. They're going to have the majority of spaces available. It's just not going to be easy. If they give us more doses, we will absolutely vaccinate more people. We're struggling to get, our 100 hasn't even really been guaranteed. We've just sort of been told that's what it is, so they sort of plotted it out. But local public health has been left out of a lot of decisions, and that's certainly a little bit frustrating. And then there's different state agencies that are all sort of jockeying to go to the top and to get different clarifications on items, and sometimes the way that information comes out is it goes to one of these executive agencies and it's not really coming from the command center necessarily, and then we're all there trying to interpret what it means. And again, as today, it's housing authorities will come out of the housing authority stock and not the local public health stock, and it's like, so housing authorities have a stock? No, they don't have a stock. They're just going to allocate it separately. Question, do we need nurses to volunteer with vaccine administration? No, we've got plenty. We've got 3 on staff, and we've got some of the school nurses to help out. We just need vaccines. That's the biggest problem. We could stand up a mass vaccination center and do thousands of people in a day. We just need the vaccine. I know that there's certain towns that may not have the capacity, so maybe that's why the state decided to go with some regional centers and try to focus on it, but we've always had the capacity like a lot of towns. We appreciate the offer to volunteer. We will let people know, certainly, if we do. We had planned that we could get all of the teachers in the school system plus St. Catherine's done in 2 days. We have 3 nurses on staff, and a couple of school nurses volunteered to help out. You set up your 5 stations, you got a couple of people doing your admin, you come in, you're registered, boom, 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 you go. The easiest thing about this process is actually giving somebody the shot. It's simple. Just give us the vaccines and we can make it happen. That's a good point. Seniors may not only need the bathroom. If I'm waiting in line for 2 hours, I need the bathroom too. Maybe those lines will go away. Maybe it's just sort of that first phase of getting familiar with it. Even as we do every little clinic we do, we learn a little bit more, we make it a little bit more efficient. I can't picture our seniors in their 80s and 90s waiting 2 hours in line. It's not going to be good. Now, some of them may be able to go right up and just get their shot and go, but it's a matter of a challenge. And the second shot that you get usually has a little bit more of an adverse reaction, and I'll talk about that in a minute. Sajal, great. Any news on local pharmacies will be able to get COVID vaccines? We're prepared and trained, not shy, word on us. I have no idea. That to be candid, the state has bungled this, and so has the federal government. West Virginia, little old West Virginia, used a lot of their local pharmacies and actually has a better vaccine rate than the state of Massachusetts. We find ourselves in the same position that we're able to vaccinate as many people as we need to. Just give us vaccine. And another frustration on our part at the local level is we don't know who else is getting vaccine. So, we know, anecdotally, you can look at the map and you hear about this or you hear about that, but the VA got vaccine and they were giving it to, any veteran who came in. Well, all right, does that come out of our supplies? Should we be directing people there? We don't know. And then supposedly CVS and Walgreens, big companies, are getting vaccine. I don't know what they're getting. So it's just a matter of, I agree with you completely. The state just doesn't see, and I'm not blaming the state in terms of every single person that works for the Commonwealth of Massachusetts or every department. I mean, the governor's at the top, so we can blame him. And then again, I think his concern being we're not getting enough vaccine from the federal government, but it's very frustrating. If we just had the vaccine, Karen, I agree. We can all call the governor and say, give the locals more vaccine, and we can do this. As I said, we could have done the schools in 2 days. If you give me all the vaccine, we can still do them in 2 days. That's still our goal. If you gave me 30,000 shots, we can stand up a mass vaccination system. Yeah, Catherine, I know you work for the state. It's definitely not you. And candidly, I think if the state had more vaccine, they would give it to us. It's just our country has prepared for these things for years, and for whatever reason, and you can blame the federal government, people are not using approved plans, and they're not using systems that have been developed and trained on for decades. The state also may have, and I know there's a desire to get the vaccine out there, but there probably should have been a longer wait to get to certain groups so we can continue with those critical workers and wait. I know that we want to get seniors done early, but I'm wondering if we should have waited until we had enough vaccine, because instead we've now created mass confusion for our poor seniors who don't know where to call. And just to give an example of how much of a cluster fluff this is, we opened our first public clinic for online signups today. And by public, it's anyone in those phases. And we quickly had to shut it down and cancel a bunch of appointments because somebody from Agawam booked an appointment, somebody from Winthrop booked an appointment, somebody from New Hampshire. I mean, kudos to them for trying. They're being entrepreneurial. They're getting out there. I didn't. So it's like, well, wait a minute. Local public health is only getting 100 doses to handle local residents in Norwood, and I certainly don't have the capacity to vaccinate Winthrop and Agawam, although I might just call the state and say, if you just give me their doses too, we'll take care of them, because it'd probably be a little bit easier. Understanding that I don't think there's a massive supply of vaccine just sitting out there that nobody's giving us, I just think a small reallocation would allow us to serve our vulnerable seniors a lot easier and to just get teachers done as soon as possible. Dottie, that's a great question. The vaccine is free, but here's another problem that we had. Some senior today was directed to some site that asked them to put in a credit card. You never need to put in a credit card. You never need to pay it. The insurance information is because those administering the vaccine will get reimbursed by the insurance company, who will get reimbursed by the federal government, in theory. These are one of those things where the federal government says, sure, that's how it's going to work, and I think it's $90 in total is what you're supposed to get. So if we do both vaccines, so if we have you come in, Dottie, and we do both things, we in theory can submit that to your insurance, who will give us $90 for the admin fee, who then submits it to the federal government, and they get their $90 back for doing the cost of the vaccine. Whether we'll ever see that money, I have no idea. Those are the things that we get told, but insurance is always helpful. Amanda, yeah, if people want to call the governor and say, give local public health everywhere more of a role, that's what we're here to do. I think the governor probably needs to, maybe listen to his own local public health staff a little bit more. And I know the governor's under a lot of pressure. But there's people who have been planning for these things and training for these things for a long time, and nobody wanted to listen to them. Nobody wanted to listen to our epidemiologists when they started saying, this is a concern, this is what it needs to be. It's sort of like everyone wanted to manage their own pandemic in their own way. But certainly reaching out to the governor saying, you really need to please give local public health more access, because we can get it done for our seniors and we can get it done better, is what we could use. Same thing with housing authorities in the schools. It's just, if we had the vaccine, we could do it. I don't know what the overall distribution is, but 20,000 for Gillette sounds pretty good, but it's like, give me 1,000. Nobody should, great question, Michelle, nobody should ever get turned away from getting vaccinated for not having insurance. Certainly never in Norwood, and certainly nowhere else. It does help to provide your card because the federal government is paying for this, but if for some reason you are uninsured, you will not, under any circumstances, get turned away, and you should not. Call anyone who will answer. Call the media, call the press, call the governor if you have people getting turned away. But be respectful. If we do have a card, please give the card, because that would be particularly helpful just to make sure everyone can get reimbursed. I mean, maybe at the end of the day, the town makes $50,000 or $60,000 off vaccinating people, but I'll wait to see when that happens. Yeah, Dora, so it shouldn't be an issue. And remember, if anyone's without insurance, you still can get tested at the Norwood Hospital testing trailer. You do need a doctor's order, so you got to figure out how to work around that. But just call a doctor's office and tell them to fax a note, or just call me directly, and we'll find a way to get that taken care of. Because we were able to have an allocation, part of our agreement with the hospital, for folks who are uninsured. Doris, I'm not particularly that familiar with the state's health insurance laws, but I think you pay a penalty if you're not insured. So you might want to see what that differential is, but certainly not my area of expertise. So as I said, our little bit of a cluster when we opened our own clinic, having to cancel appointments because we're certainly not taking people from Winthrop and elsewhere. I think there were some people, understandably, on the state map just clicking anywhere and looking for open appointments, but some people, oftentimes out in Western Mass, when I worked out there, lived out there, we would say people from the eastern part of the state don't realize how far Western Mass is, and maybe people in Agawam don't realize how far Norwood is, but we certainly can't take care of folks from Agawam and Winthrop with our measly 100 doses a week. So if you're able to help your senior, if you know somebody, if you have a parent or an aunt and uncle register online, by all means help them. The Gillette site, they are opening that every week with their new appointments. They're supposedly around 20,000. We don't know if that's weekly or on. It seems to just be a generic number that's thrown out there. If you know a senior who is absolutely unable to register online, they can call the senior center and Carrie will help them get registered. It's just going to take probably longer that way. If we end up with a 1,000-person list there, we get 100 doses a week, but some are always allocated to other people in the phases. It's just going to take a long time. Really sort of not a seamless rollout. But I understand the pressure to get the vaccine going early. Dr. Fauci did say that there's states out there that have capacity but no supply, and states out there that have supply and no capacity. Every state's doing it a little bit differently. How it was determined what Massachusetts would get and when we're going to get them is beyond me. Moderna has been producing since the summer, so has Pfizer, so it's going to get out there. I just think that the idea of everyone sort of being vaccinated by July, we'd kind of hoped that we'd make great progress in February, March, April. I think it's going to be more of a May, June, July, and we'll just have to wait and see how that sort of rolls out. So the good news is more people are slowly but surely getting appointments and vaccinated. The bad news is we're not getting as much vaccine as we can want or administer. Locals are being left out, as well as small businesses are being left out of it. And unfortunately, housing authorities and teachers have been delayed, so we're going to continue to try to pull what strings we can get to get that done as soon as possible, and hopefully do it locally so we can just get it done and folks can start moving on. But we're facing the fact that we don't get to control where the vaccine is. I've got some other updates before I move on. Does anyone have any questions about COVID or the vaccine? I'll scroll through and make sure I got some of these. Yeah, I agree. Gillette is not the best system for the vaccine rollout, but those decisions are certainly above my pay grade. So again, any comments you have, you can always leave us and let us know, and we will. I'll move on with a couple of other updates, but we are as frustrated and upset as everyone else is about the way the rollout's sort of rolling. And I guess it's also just the fact that it seems to be changing almost daily and corrections made daily, and it's impossible to plan or to know what's coming down the pike. But a couple of other updates. Oops, sorry, I scrolled in the wrong direction here. We have a town meeting information session tonight at 7 o'clock. So this is just a kind of a quick review of the warrant articles, just sort of a little bit about what they are, and then a chance for Q&A. I'll be there. I think Tom McQuaid will be on, our Chief Financial Officer, Chairman Plasko from the Selectmen, Paul Halkiotis, and Pat DeShane from the Planning Department. Travis from the Rec Department will be there. So really any of the departments with articles will be there. Just a chance to ask questions. There's videos that should be on NCM now that are just sort of reviewing the articles, and you'll know that some of those are pretty quick. That's what we'll be doing tonight. It'll be sort of a quick review, just explaining what it is, but giving people a chance to ask any questions they may have ahead of town meeting, which is next week on February 4th. Town meeting will be remote. It's being done by Zoom. If you're a town meeting member and you haven't registered yet for one of the trainings, actually, we still have trainings left. I would highly recommend you do that. It is a little bit of basic of how you use Zoom, so you may think it's beyond you, but I think it's particularly helpful to see how it gets used in the context of doing a remote town meeting. I think that's important as well. Town meeting is on the 4th, and a quick note on the budget as we start planning our budget work for next fiscal year. The state has released its state aid numbers, and they're not as positive as we would have liked them to be, in particular on what's known as Chapter 70, which is school aid or aid for schools. Your number is really based on your student count. So as your student count goes up, it's great. You're getting a lot more aid to deal with that. If your student count is flat or declines, you're classified as what's known as a minimum aid community, which means you only get a certain dollar amount per student. So that dollar amount per student ends up being, I think it's usually around 25 or 30 bucks, and there's always people advocating for it to go up more. Of course, rural communities tend to always be minimum aid communities. Norwood having not been in that situation, at least in recent memory. So last year, I think our state aid increase was probably around $900,000. This year, total, we're looking at maybe $200,000. So Blue Hills changed their student numbers from, they had 850 is what they allowed in. They've increased it to 900, and my understanding from one of their committee members, for some reason, is out of those next 50 students they let in, a majority happen to be Norwood kids. So that takes money from Norwood Public, moves it over there along with those students, but also shows a decrease in our student number. And we did have several people either sending their kids to private schools or choosing to homeschool them for the year. So it's, the override put us in a good financial position. We'll be able to bridge through this year, but it's certainly taking a hit, making it a little bit more of a challenging or less fiscally sound year than we would have liked. Although we're at the very beginning of that process, not the end. Joe brings up a good point in the comments there. If you're planning to join us tonight for the information session, and it is a town meeting information session, but it is open to anyone, not just town meeting members. You do need to register, so please register. You can find that information on the website, and Joe will get it in the comments. The online Zoom trainings for town meeting members, there is one more of them. I highly encourage you to do that if you are going to be at town meeting this year. On a positive note, we are already looking forward to outdoor dining returning and Central Street returning. We're anticipating Central Street probably opening sometime in April. We're going to sort of see how the weather is and what the forecast is. Maybe before the school's April vacation, if they do such a thing this year, it would be a good time to do it. We want to make sure that the ground is free of snow, that we're having a reasonable spring, it's not too wet or too cold. Outdoor dining, we got to go through a process with some of the restaurants, but they're going to be authorized to do it again this year, and some of them could start really as early as they want. We probably won't be blocking any parking spaces on Washington Street and elsewhere in town until maybe later in April, just to make sure we have no snow. But we're looking forward to Central Street coming back sometime in April. We think it'll be fun, maybe even a little bit earlier. Doris, why do people send their students to Blue Hills? Do we survey them to see what we can do better? Yeah, so every town I've worked in that had kids go to a VOTEC school, it's never that the public school isn't doing something or could do something better. VOTEC schools are just different. They actually attract a different kind of student right now. It's a little bit of a challenge in the VOTEC world that it used to be kids going towards just a blue-collar type job. Now you have kids who are going to Blue Hills or going to VOTEC to study something, and then they're still going on to college and getting a liberal arts degree. I'm sure for some of these kids it's just a little bit more interesting. It's just a different, model of Blue Hills. I know they do their week on and their week off. So, could we look to mirror some of those programs? Sure, but there's not like that one thing that every year 200 kids from Norwood are going to Blue Hills just to do automotive, and we could say, well, why don't we do automotive? It's sort of spread out all across their different things. I mean, if kids are some more certain what they want to do, they want to study cosmetology and hair, they want to study auto mechanics, that's where they're going. So they're always working with them. It's just Blue Hills accepted more students this year, and for some reason we were like the next group on that list were a lot of Norwood kids. So it should be a one-time correction, but you never know. But they're always looking at it, and they're always looking at the tours that they do and what they can offer. But it's been my experience. I haven't been as involved in it here as I was out in Western Mass. Some kids just are, hey, I want to study this, and I think it's more interesting, and I'm probably still going to go on to get a degree in accounting, but I want to go and take automotive because I find it interesting. Will tonight's info session be recorded and rebroadcast? Yes, absolutely it will be. If NCM doesn't record it, we'll be recording it, and we'll get it up. Not too long till town meeting, but we will get it out there, and it's a good chance to do it. We're going to try to continue to do this throughout town meeting every year, where we're getting this stuff out as early as we can. This is, again, a little bit of not a challenge, but an odd year in the sense that we sort of did some of this earlier in the year, and then we had a pause town meeting, so it's been a little bit more confusing than normal. Last but not least, on the hospital, Chairman Plasko Tuesday night made what I considered a funny tongue-in-cheek comment. He said, we met with the hospital and they swore us to secrecy, and I was trying not to laugh behind my mask because they were worried about what they could tell us, except that they didn't really tell us anything. And it's like, yeah, they're worried about telling us stuff, except they don't tell us anything. They do. Steward's been, they've kept us in the loop as far as we know with what they know, which is they're still working through their insurance process, and it's very complicated. and there's magnitudes of tens or hundreds of millions of dollars on the line here. They did tell us they're anticipating having some sort of an announcement in April or May, so maybe they'll reach a point where they've either concluded that insurance process or decided to move forward. We certainly hope that's a positive announcement in April or May as we approach 1 year without the hospital. So they continue to communicate with us, they just seem to never have any updates, which is understandable. There is a zoning ordinance to rezone the hospital lot, and I want to talk about that for a minute. It's important that it passes. The hospital steward was appreciative that it was we were being proactive and that it wasn't going to be something that they'd have to wait for down the road. Somebody sent me an email today saying that they don't like the height of certain buildings and they think the hospital should be limited to only 3 stories. I can tell you, if we ever foolishly did try to limit the hospital to 3 stories, we would not have a hospital in town today or ever. I think the top center part of it's maybe up to 90 or 100 feet with a step back, and those are just the rooms, is how the zoning is designed. It was fairly standard boilerplate from other hospital overlay zones. I mean, you couldn't rebuild the hospital the way it is today with the current zoning. It's one of those types of lots that you often don't change the zoning on because, well, there's a hospital there, so what does it matter? So it gets stuck with some designation that it had a million years ago. So we're trying to be proactive to help that process move as quickly as possible. We know it's not going to be a 40-story hospital. We know it's not going to be a 1-story hospital. So, you pick similar to what you'll probably see in Weymouth, but newer. Newton Wellesley, but newer. There's models all over the country for when hospitals get built. So we're being proactive. We're expecting some sort of a positive announcement in April or May, and the hospital zoning change is important. It's one more thing we can sort of get out of the way and gear it up. They still have to go through all of their regular planning and zoning process, which will take time in engineering and design. They continue to tell us that they are committed to being here in Norwood and rebuilding in Norwood. Somebody did send me an email somewhat complaining about Stewart being a private company and saying, oh, well, this private hospital, it's not a private hospital, it's privately owned. And that's actually a good thing. They do pay close to $1 million a year in property taxes. So, if there's a hospital there and it's private or nonprofit, I guess as a bureaucrat, I'd take the property taxes over not taking the property taxes. Not that it's all about money. Great comment by Eileen. Yeah, the VA in Bedford is taking care of veterans over 65. They were doing some veterans under 65. This is one of the, it's a bright spot, but it's one of the frustrations with the vaccine rollout that there didn't seem to necessarily be coordination between that, where we got word that here's where veterans should go, because we hear about it and they're saying it, but we don't know what their supply is, and I don't want to turn 900 veterans over to them finding out that they can only do 500 a day, and we have no idea what their stockpile or what their supply is. If it had all been a little bit more coordinated, then we could have gone and sort of gotten a slightly better rollout everywhere. But I guess the other side is it has been 100 years since we've dealt with a pandemic, so some things have to be relearned. We've been told all along that the hospital that they want to rebuild, that they want to build better, build a bigger hospital, a more modern facility, because the current facility just couldn't be. I hope that comment got deleted or something. Couldn't be rebuilt the way it was. So Stewart has always said that they're committed, that they're going to rebuild, that they want to build a brand new hospital and they want to make it better. They've just got to work through their insurance process, which is complicated. I mean, they're looking at the hospital as a total loss because the idea that you would go through and completely bring up to code and completely rewire and completely restructure a building that in some places is 50, 60, 70 years old would end up costing more than building a brand new facility. But a brand new facility is probably $150, $200 million endeavor, maybe a $300 million endeavor, which is great once it's there. It's the process of getting there. But from everything I believe, I guess from a practical standpoint, could they walk away? What would they do with the building? Most commercial insurance policies, you can't just take the money and then sort of walk away and leave it there and somebody else would come in and get it. So I don't think that's a possibility, but I also thought the hospital ER would reopen in 6 weeks. But I feel confident that after we pass the zoning next week, which, assuming town meeting goes forward with it, hopefully come April, May, we'll have a good announcement and at least a plan or a path going forward from Stewart about when is it going to happen. They're a private entity, so they're losing money every day that they're closed, and as more and more people get adjusted to other hospital groups and other hospital groups expand their services, they could continue to lose their their clientele. And hospitals sort of networks generally work on a feeder system, so you lose that entry into the feeder system and they're not sending them to other hospitals, so those hospitals start losing their patients, and your competition is able to move in. So in this sense, I think the free market is kind of to our benefit, that we have that going on. And I believe that is all I had. As always, we'll take any questions or comments on the in the comments, and you can always email us at managers@norwoodma.gov. We'll continue to bring you weekly COVID updates. We'll continue to get vaccine information out there. I think the big thing is please be patient. If you do talk to anyone at the state, getting locals more shots means we can get it done faster and more efficient, getting us more vaccines. And just be patient. I know we're all waiting for our seniors to get their shot. You're going to hear about some people getting it right away. It's just going to take time. It's going to take a long time, a little bit longer than we anticipated. But we're going to keep on keeping on. And with that, I'll leave everyone. I hope you have a wonderful weekend. Those of you who knew Bernie Cooper, as I said, this is the beginning of remembering and celebrating his life and his impact on the community and all of us. So by all means, if you knew the family, you can send them a note or just say a prayer for the family and for the rest of us as we sort of continue to do what we have to do, mourning the loss of Bernie. I'm not sure which COVID helpline. If you're for the senior center, you can just call the senior center directly. It's you can call us at town hall and we connect you. I think the senior center is 762-1241. But if you go on the health department page, or you can even email the senior center directly, and they'll get you taken care of if you're trying to register for senior parents. But we always encourage everyone, if you can go to Gillette, and we know that's not an option for everyone, in some ways that's the best option, just because our 100 doses a week are going to go quickly. So thank all of you. So Doris, 2 quick questions. What would it take to get a second ALS ambulance? It's actually just a matter of assigning people to do it, but it's a bargaining issue, so you have to come to an agreement on it. Getting rid of all dispatchers in 18 months. We're looking at regionalizing our dispatch, which is what the state is pushing. So everyone who has a cell phone, you pay a tax that's called the 911 tax. That goes to the state. The state uses that money to fund regional dispatch conversions because the state wants everyone to go into a regional PSAP or a regional public safety answering point. It's a system used in most of the rest of the country, and Massachusetts is just a little bit lagging behind. What we've done here is trying to do it in a way where we take care of our people, but 4 towns south of us just combined and went into one. There's Semrec, there's the Foxborough one, there's the Franklin one. I mean, regional dispatch it's not even the way of the future, it's just sort of the way of 10 years ago or 15 years ago. Certainly substantial financial savings for the town, and again, the state charges you a tax to fund making everyone go to regional dispatch, so they're always asking that cities and towns look to do it. So it's a wise idea. Take a look at the state's 911 website, and we'll probably eventually be there, but there's a long process to get it done. So thank you all very much, and I hope you all have a wonderful weekend, and take care. And as always, questions here in the comments, or feel free to email us at managers@norwoodma.gov. Thanks, everyone.